Hi, it's Susie from Svelte with a quick video on how to inject semaglutide at home, subcutaneous injection. First of all, your Sema vial, it's breakable, so you want to be really careful when you're handling it. Don't drop it on the granite countertop. Don't drop it on the tile floor. It's expensive. Be careful with it. It's best to keep it in the little plastic cylinder lid thing that it comes with. I don't have mine, but it's best to store it in there. And then you just want to keep it in your fridge. I just took it out. I've also got my alcohol swab, my sharps container, and my insulin syringe, and my dosing sheet. The dosing sheet is really important. You want to record the date that you're doing your Sema and how many units and what site you injected, okay? So your Sema vial, you just want to take it and clean the top, rubber stopper top with your alcohol swab. Clean it like that. Then you can actually use this same alcohol swab to clean your skin where you're going to be injecting. We do want you to rotate your injection sites. This is really important. You want to use a different site every week for 4 different weeks, okay? So you can use, the sub-Q tissue on the back of your arm. You can use sub-Q tissue on the back side of your leg. You can use the sub-Q tissue here on your belly. This belly fat on top of your rectus abdominis, that's the belly fat called the omentum. And everybody's got an omentum on top of their 8-pack. Your 8-pack is under there. So, but anyway, you don't want to keep injecting the same place every week. All right, you want to move it around. So this week, I'm going to inject this part of my omentum, the left side. This is kind of embarrassing, but it is what it is. You want to grab that subcutaneous tissue and pull it away from the muscle. This is a subcutaneous injection, not an intramuscular injection. All right, so subcutaneous needles are really tiny. See how little that is? It's a little insulin needle. These syringes come with a little stopper at the back of the hub, so you just want to take that off. I like to prime my syringe just a little bit. This gets the stopper, the rubber stopper in there warmed up so it doesn't get stuck. Do not worry about bubbles. Don't worry, this is not an intravenous injection. This isn't even an intramuscular injection. It's sub-Q. We don't care about bubbles. If you're trying to flick bubbles out of your syringe, you're wasting Sema. Don't do that. So you want to take your sterile needle off of your insulin syringe, and you're going to aim for the very center of the rubber vial top. I'm right there in the very center, okay? Then you're going to flip the vial over and withdraw your dose of Sema. I'm not really doing an injection today. I'm doing a phantom injection, but I'm just showing you when you draw up, there's these little hash marks, and you're gonna wanna look at your dosing sheet and draw up the appropriate hash marks. If you've drawn up too much, it's okay to push it back into the vial, okay? Once you draw up the amount of Sema for your dose that week, then you're gonna take your syringe, your needle, and you're gonna grab that subcutaneous fat, and you're gonna stick yourself, and then you're gonna inject the Sema. I usually just let go of the tissue and then withdraw the needle. If you're still squeezing the tissue when you withdraw the needle, sometimes you can lose some Sema there. Once you withdraw your needle, you're gonna put it in the sharps box because it's used. Don't reuse your needle. And then you're gonna make sure and put your Sema or Mounjaro, put it back in the fridge, okay? And remember, the vial is glass, it's breakable, and it wants to be in the fridge. Don't pre-draw it up into a syringe and try to take it on vacation. If you're traveling, you want to take your vial and your syringe and your alcohol swab with you. You don't necessarily need to take the sharps container with you. A lot of places, hotels and stuff, they'll have sharps containers for you. If you want to travel with your sharps box, I'm telling you, you might get in trouble at the airport. If you pack it in your baggage that's under the plane, you'll probably be okay, but sometimes you have to show that you have, you know, some kind of prescription for carrying one of these, so that's why I don't recommend traveling with them. Okay, so once your Sharps box is full, you take it to the fire department and they dispose of it for you. Now remember, with Sema, it's not a magic bullet, okay? You still have to eat really healthy. In fact, when you're on semaglutide, your body's gonna tell you if it agrees with certain foods or not. For instance, if you're eating fried foods on semaglutide, you might get a worse tummy ache. If you're drinking alcohol on Sema, you might get really bad headaches. This is not a magic pill. You've got to watch what you're eating. You want to eat clean. Look at your Svelte Survival Guide, your little Sema book that we gave you when you started. Look at that for the healthy food choices and then the foods to avoid. And you're really going to have to be smart about hydration. You're going to want to drink lots of fluids when you're on Sema, although conversely, your thirst can be suppressed by Sema. So this is why Svelte created Svelte Solutions IV Lounge. You can get dehydrated on Sema just because it suppresses thirst and you're not drinking enough. If you want to come in for an IV hydration therapy, you get 20% off when you're on Sema. And the IV hydration, I've done it twice now. I absolutely love it. Your skin glows, you have all this energy. It's amazing. All the toxins get pushed out and it really helps optimize your Sema therapy. All right, remember to call us at 407-804-5200 if you have any questions at all, especially if the dosing is not right for you. We can titrate that. We can move you up higher, okay? If you're not getting any results after the first 2-3 weeks and you're like, man, I'm still hungry, this isn't working, we need to move your dose up. Conversely, if you're having a lot of side effects and you're into that second vial and you're sicker than a dog, we need to back off your Sema dose. That means your vial is gonna last longer. Conversely, if you need more Sema and you have to crank your dose up, your vial may not last as long and you need to pay attention to how much you've used out of it. That's why that dosing sheet where you write down what you've given yourself is so important. And remember, the maintenance vial, which is $450, that has 200 units in it. So its max dose is 50 units. Not everybody needs 50 units on maintenance. In fact, a lot of people cannot tolerate 50 units. So you might be somebody that needs the 50 units and you're gonna go through a maintenance vial every 4 weeks, but you might be somebody that 25, 30 units is perfect for you on maintenance, and your maintenance vial will last you 7-8 weeks, okay? We look forward to seeing you again at Svelte. Call us with any questions. I'm Susie, signing off.